Thank you and good morning. No matter how our country looks, it is good to be home. And let me say that Dominica for me still holds the same charm that it held prior to Maria. I want to begin by truly commending the people and the government of Dominica, the Prime Minister and his cabinet, on the work that has been done thus far, following what is one of the worst disasters in recent history, and a disaster that is compounded by our terrain, a disaster that was compounded by the lack of communication, and still the difficulty in accessing some communities. From health, I also want to commend the health staff. The health professionals of Dominica have paid really yeoman service to this country, working even when they themselves had suffered losses, and even bringing patients into whatever was left of their homes to deliver services and working long hours. So I really would like to acknowledge and commend those healthcare workers. We are here as PAHO, and our responsibility all over the Latin America and Caribbean region as it deals with emergencies is to prepare our countries to face emergencies, but in the immediate aftermath of a disaster, to be there. If we can pre-position, we do, to help with the immediate response and also to help towards recovery and rehabilitation. So we were here, as you heard the Prime Minister, from the first day, and immediately we began to mobilize for the response. Our work is not to work as an entity, but to work closely with the Ministry of Health and to help with the coordination of the health response, taking into consideration all of the assets that are available from neighboring countries, from entities who are on island and also off island. So this is what our responsibility is under the UN humanitarian arrangements. I have met with the Chief Medical Officer, with the Minister of Health, with the Permanent Secretary, the Director of Primary Healthcare Services, and all of the managers of the Ministry of Health. I met them in the OSC yesterday and had private meetings with them. So the update that I will give you is based on those meetings that I've had, and certainly the information that was given me by these officers. Important to note that in terms of services, that the hospital service is about 80% functional, and this is tremendous, recognizing that the hospital had suffered significant damage and loss of water and loss of electricity. It is 80% functional. There is a reduced bed capacity. All the major specialties are functional, except very limited oncology. The dialysis service has been restored. The laboratory is not fully functional in that they are not able to do some tests, what we call the chemistry tests. That is because they require reagents. So PAHO is making the arrangement to get those reagents so we can be fully functional in the laboratory. We also had to work with them to secure blood, and we can report that today the blood has arrived from Barbados, so there is access to blood on the island as well. Working on the primary healthcare system, all the type 3 health centers are functional. In respect to Marigot, the accident and emergency services are being delivered from Wesley. The report that we received from the type 3 health centers indicate that they are fully stocked with regards to medicines. So they are fully stocked. However, we've requested that another analysis be performed, given the fact that many persons may have lost their supply of medication, particularly for those who are chronically ill. In some of the type 3 health centers, we have seen some additional staff, some volunteer staff, both in terms of medical and nursing staff. I think more could be done there if we were able to identify some accommodation for volunteer health staff, because we do have many countries volunteering to send staff, but it is very difficult to send staff to type 3 health centers without any accommodation. So if that could be done, then PAHO can work with the Ministry of Health to make this available. I need to say something about volunteer medical and nursing staff. Remember that no one can just come onto the island and begin operation as a medical doctor or as a nurse, that all of this has to be coordinated with the Ministry of Health. We need to ensure that the people who are coming here with a stethoscope around their neck and claiming to a doctor, that they are truly doctors and that they are able to be registered. So this is another layer of protection for the people. I think it's important also to stress that the Ministry of Health staff at the hospital and health centers have been working flat out. Some of them lost their roofs as well, and so we have helped. PAHO has helped to give them some tarps so they could do some temporary sheltering of the houses. But it's going to be important to ensure staff welfare for them, because if they must be in the areas of work all day, they do not have the possibility of going to look for themselves. So we are developing with the Ministry of Health a schedule for the replacement of staff, because by now you know that staff is truly, some of them almost burnt out, very tired having worked all of these hours for so many days. In terms of drugs and medical supplies, I did tell you that your type 3 centers, the 7 reported full stock, and we are assessing that. Central Medical Stores does have large quantities of what they require in terms of their normal stocking. There is some work that's going to be done in Central Medical Stores to ensure that all of the supplies that they require are actually in stock. And so there are 2 people that will be hired by PAHO, nationals who've had training in supply management, that will go with Central Medical staff to ensure that we do have all of the variety of drugs and medical supplies that will be required. We have lost all of the vaccines in country because the cold chain was interrupted because of loss of electricity in all of the facilities. Therefore, all of the vaccines are not usable. So PAHO we are working now to develop a project for the funding of vaccines for the country for a year, and to look into and assess the cold chain and ensure that there is cold chain refrigerators and vaccine carriers, etc. We listen to health education and health promotion, and there are messages that are already being broadcast, and also by telephone. It's going to be very important that people listen to those messages. They're also going to be doing some loud hailers within communities to spread the message, and deploying a number of persons, redeploying them from what they are doing now to do community education, yard to yard, house to house education. And PAHO is assisting with that, and the possibility of having some printed material. It's going to be very important, because persons survive the hurricane, they must ensure now that they remain healthy and that they survive. So messages like boiling your water, and unless it is bottled water. We have brought in some 60,000 water purification tablets, and each tablet can purify like 5 liters of water. So we are also asking people to go to your health facilities to access these water purification tablets. We need to reduce mosquito breeding sites, particularly the Aedes aegypti mosquito, which breeds in and around houses. With this amount of debris around, it's going to be very difficult to do that. But every householder has to be responsible for cleaning in and near his house. As the Prime Minister said, drains that are blocked, we should organize community action to take care of this. And we are also doing treating of mosquito sites. Remember, Aedes aegypti, we have to think of dengue, we have to think of Zika, and we have to think of chikungunya. Many of those are important. We have, because there is no refrigeration, we also have to caution people to avoid eating spoiled foods. So small quantities. So that's why you don't need to have supplies for 10 days or 10 weeks or 2 months, because you really can only prepare small quantities of fresh foods especially. We need to caution people to wash their hands very frequently, even though water is not readily available, but try, for those of you who can access the purifying hand washing, hand purification, or hand sanitizers, then please do that. And you need to wash all foods before eating. Even the cans, you need to wash the top, because of course one of the things that we are looking at is to avoid leptospirosis. So there are many rodents here, lots of rats and mice, and their urine and their dropping will spread leptospirosis. So we need to prevent this from happening. So also, because we are getting a lot of canned foods, we have to make sure that we dispose of those cans properly, because cans left lying around will become breeding sites for the mosquitoes. We are also working with the Ministry of Health on surveillance of the work that was done early in surveillance is surveillance of injuries, and so we worked with them. Now we're also moving to step up on communicable diseases. Some of those diseases that we keep under surveillance includes gastroenteritis, other forms of diarrheal diseases, rodent-borne diseases like, example, leptospirosis, and respiratory conditions. It is anticipated that all of those are possible as we go into the future, and so we need to look at this. In terms of water safety, PAHO is working with DOWASCO and the Environmental Health Department to test the water supplies. And when they say that this water is safe, it is because we've conducted those tests, and that the water can therefore be used. So that's going to be important. The vector control, the report that we received from Environmental Health is that they've begun with mosquito control, and very soon they will begin the fogging measures. And the rat poison is being distributed as well. And these might sound as they are simple, but they are rather important to preserve the health and to prevent disease that comes in the wake of such disasters. I want to say that in the immediate after effect, that we were very involved in restoring the services, the hospital, making an assessment, restoring the hospital services in terms of dialysis, some of the laboratory facilities, etc. And the same thing for some of our type 3 health centers. We helped to evacuate 16, 17 patients. We were very fortunate that the Dominican Republic made this accepted to both move and take care of our patients. 11 of those are back on island. We also help with the evacuation of one person to Martinique, and then from Martinique to Trinidad, and another person to Barbados. So at considerable cost, but not at cost to the government of Dominica. And we are now helping the Ministry of Health to come to terms with the fact the disaster is over. It's almost over. The disaster is over. The response phase should be winding down. We now have to begin to look into how do we normalize some of those services that we have. And so to that regards, in about 2 weeks' time, we will work with the Ministry of Health to do a full assessment of the services themselves, not just facilities, but the services that are being delivered and the quality of those services. And also to begin taking a much longer term perspective in the rebuilding of those health services, not just facilities and where those facilities are sited, and the fact that we need to make smart facilities, but importantly, how do we organize the primary care services, for instance. I need to tell Dominica that it was out of David that a primary care system was born that was the envy of the world. So despite the destruction, we can plan into the future to have a health service that will serve the people of Dominica adequately, and certainly at a much higher level than now. The garbage and waste and solid waste disposal, that is extremely important, and to the extent that we can, we will continue to work with the Ministry of Health on this. I want to take this opportunity also to speak about the responsibility of the citizen and the responsibility of each person. The Ministry of Health cannot be, or PAHO, can't be responsible for your own health. You have to take that responsibility for your own health. And we want to make a particular plea to patients with chronic diseases. Patients with chronic diseases must take their treatment every day. And so we need to say that this is not a time to suspend your treatment or to forget to take your medication. This is a time that you need to make sure that you have stocks. If you don't have, then go to your health center, your type 3 health center, and get stocks so you can take your medication every day. And also responsibility in terms of taking care of your health as an individual, and observing many of the messages that are being sent out by the Ministry of Health, but importantly being your neighbor's keeper as well. And so that's going to be very important if, as a people, we are going to ensure that we can recover. So let me say that let me conclude by really thanking all of those in the health services. I am a Dominican. I have seen many countries with many disasters, and PAHO is always there. We pride ourselves in that within 48 hours we are there in every country that has a disaster. And frankly, I am proud of what has happened thus far in this country. This is a country whose low middle income or middle income, but with limited resources, and we've been able to coordinate the action. It's not perfect, and so we need to acknowledge that it's not perfect, but that a lot has been done. So let me say that from the halls of Maria will rise a stronger health system, and PAHO is committed to work with the people and the government of Dominica to ensure that we do have a health system that, just like after David, that will be the envy of the world. So thank you for allowing me this opportunity, and it's so good to be home. Thank you.